So we're out here today, out by Britannia Community Center on Commercial Drive, and we're just going to see what people think or have heard about the conversation on health in BC. So your names?
Hey, I'm Jeanette.
Gail.
And have you heard about the conversation on health in BC?
No.
No.
They're probably not the right people to
Yeah,
interview.
probably
I haven't
not.
even watched the news for like a year.
Wow.
Yeah.
Well, I'll just give you a little information. Right now, the government is conducting a conversation with members of the community province-wide in 16 communities, and they're just wanting to get feedback on what us British Columbians like and want to keep and for healthcare. So what would you tell the province?
We need better hospitals, better upkeep of the hospitals, more nurses, more doctors, more emergency care workers. That's what I think.
And what do you value about our healthcare?
I value that everyone's entitled to it. That's what I value the most.
Hi, what's your name?
Shauna.
And what do you think about the current conversation on health that's going on province-wide?
You mean like the talks and stuff?
Yeah.
I don't know. It's nice that they're getting input from the public. Hopefully they'll do something about that.
And what do you value about healthcare?
I think like less waiting times. That's a big thing for me. I wouldn't want to wait a long time to like get anything necessarily. If they could, I think we should privatize.
You think it's
Yeah.
privatization?
Yeah.
So two-tier?
Yeah. I think that's the way to go.
So have you heard about the conversation on health care in BC?
No, I haven't.
Do you think this is a good idea?
Yeah, sure. I mean, if they're going to listen, that's the point. It's whether they're going to listen, right? Because this government really is, it's shown in the past that it's just, the only people it listens to are the big business. You know?
And what would you like to see change in the healthcare system?
Well, more of a community approach, like the sort of community clinics that you got in this we got in this area of the east side, and yeah, that kind of thing. I think just a more of a preventative approach too. I mean, it really annoys me that the doctors make millions and millions, and yet nurses have to struggle, and more than that, they've delisted chiropractic, massage, and what was the other one they delisted? It was another of these preventative type of, more holistic type of approach to medicine. And I mean, that's what we should be doing instead of making the surgeons rich, I mean, more of a preventative, holistic approach.
Hi, so what's your name?
Christina?
And have you heard about the conversation on health going on in this province?
Yeah.
And what do you think about it?
I think it's pretty sad, and I think it's really hard for people who are sick and don't have a lot of money to actually get the health care to get better in order to work all the time and make money and keep their lives better. So I think it's really difficult, and I know there's been a lot of cutbacks.
Or we're getting less?
Yeah. I know when my mom died, she was basically died in emergency because they didn't have a bed for her. So that was several years ago, but still it was quite an undignified way to go. Yeah.
And what would one thing you would want to change about the system?
I would like it to go back to its original purpose, that everyone can have universal free health care. Well, I think there's a lot of money being spent in a lot of wrong places, and there is extra money left over, and it should be going to health care.
What do you think about privatization?
That's a tough question. I think there's room for abuse in the government, and I think there's room for abuse in privatization. It's just that neither is a good solution. Government tends to fall asleep. Privatizations tend to capitalize. You have to watch either one. I don't have a solution. It's just that I can see the abuse and possibility in both sectors. It's obviously costing too much. Equipment is getting better and better and better, but the cost of equipment and its use is getting phenomenally high. So that's what they have to deal with, and it's not easy.
Thank you.
Okay.
The province right now is conducting 16 community forums province-wide and getting feedback from British Columbians on what they want to see in the healthcare system in BC and what they value and solutions.
No, this is the first time I've heard of it, and I think it's a real shame because I think a lot of British Columbians would like to put in there, give their 25 cents about public health care is going down. We're talking about a two-tier system. There's the discussion now. Nobody wants that. Hopefully, if the provincial government is doing this is great. But I think if you ask most British Columbians, they would say they absolutely want to maintain a great public health care system. We're willing to pay taxes towards that. I certainly am.
Do you think we should have a privatization?
I think it's working all right the way it is, I guess.
I think it might be good.
Yeah.
And why do you think it might be good?
Shorter waiting periods, the ability to go in for services that might not be covered and just pay a small fee and just get it done fast.
And what about those people that can't afford it? How do you pose that we still have a universal system?
Maybe a bit of both. Have it be what it is now and have the extra option of privatized healthcare. Because I find, the waiting periods are terrible, months and months for some simple procedures. So a lot of times I've gone to other countries just because it's a little faster.
And what was your experience in the other countries?
It was good. I got to get in and out pretty fast. Waiting periods are a lot shorter. And yeah, that's basically it.
And have you heard about the conversation on healthcare that's being conducted by the province-wide?
No, I haven't.
Have you heard about the conversation on health that is going on province-wide in 16 different communities?
I actually haven't.
And if you were to tell our premier one thing, what would you tell him?
Oh my goodness, I have to think about this for like 2 days. If I had to tell our premier one thing, what would I tell him? I would tell him to spend less money on the Olympics and spend more money on the homelessness.
Do you think privatization is a good thing?
No.
Why not?
Because we don't have the money. Nobody, it's a good thing for the top couple percentage of the people who can afford to privatize their health care, and I don't think that it's good for the majority of the people. And I definitely don't think it's good for all the people around this neighborhood.
All the people